Whilst economically developed nations, such as Australia, move quickly forward in the fight against HIV/AIDS, with a health system that can afford the essential drugs it needs, the people who are infected with the disease in countries like Cambodia continue their battle. A country languishing in poverty, Cambodia's HIV/AIDS epidemic is one of the largest in Asia. According to UNAIDS, almost half of new infections in Cambodia are among married women. With life-extending antiretroviral treatment, patients such as Dara are able to lead a much better life. Dara is being treated by Médecins Sans Frontières, or MSF. The antiretroviral drugs, or ARVs, enable her to lead a relatively normal life. Dara is one of approximately 180,000 people who are infected with HIV/AIDS in Cambodia. Here, MSF runs its largest HIV/AIDS program in Southeast Asia. Since 2001, MSF teams have been providing antiretrovirals. Currently, over 7,000 patients are receiving ARVs from MSF.
Cambodia is a country which is building itself since peace accords in 1991. It's a long process. Regarding economics, they still benefit from a lot of subsidies from outside. Regarding HIV/AIDS, the first objective, of course, to reduce morbidity and mortality in all of our contexts. And we want also to provoke a change. In a country where today the prevalence among adults is 1.9, which is low compared with African countries where you have very high rates. MSF was one of the first actors to introduce antiretroviral treatment for HIV/AIDS patients.
ARV drugs do not cure AIDS, but they are needed in order to directly combat HIV. They can improve a patient's quality of life and prolong survival when taken as prescribed. When patients start ARV treatment, they begin on a combination of drugs known as first-line drug therapy. However, patients will develop resistance to these drugs. At this stage, second-line therapy is necessary. However, the drugs used for second-line therapy are mostly unavailable or unaffordable in developing countries such as Cambodia. MSF is continuing to lobby for more affordable second-line treatment in developing countries.
We estimated around 150 and maybe 200 persons on second-line treatment today in Cambodia. But of course, this will increase with time. Even if the percent will remain the same, since more and more patients are put on ARV, we have a higher number of patients in need for second-line treatments in the near future. Clearly, it's a compromise. We have to find the best moment for switching, and we don't know yet what is the most appropriate strategy for that. So when to switch, very important, and which tool we have to use for switching is also important, and the viral load is a key test for that.
MSF is also looking at a largely neglected aspect of HIV/AIDS, the deadly co-infection that is tuberculosis, or TB. With this problem not only affecting HIV/AIDS patients, the number of TB cases in Cambodia is rapidly increasing. TB is a highly infectious disease. Treatment for TB patients is very long and complex, with patients relying on treatments developed 50 years ago. They must follow daily treatment for 6 to 8 months, which is intensive and can cause severe side effects.
TB is a huge epidemic in Cambodia. 10% of TB patients are infected by HIV.
If this is not enough, a major obstacle is the rapid emergence of an even deadlier form of the disease, multi-drug resistant TB, or MDR-TB.
So MDR-TB is a kind of resistant TB. The bacteria, Mycobacterium tuberculosis, in these patients is resistant to both rifampicin and isoniazid. These are the two main drugs of the first-line treatment. And once a patient is resistant to these two drugs, rifampicin and isoniazid, is called MDR-TB. He has multi-drug resistant tuberculosis. And these second-line drugs are more toxic. And second, this treatment is very long, at least 2 years. And the monitoring of the patient has to be very, very close.
Patients with HIV have a much higher risk of contracting TB due to their compromised immune defence. Fortunately, Dara's immune system has greatly improved thanks to the ARVs, thereby reducing her risk of TB. Hopefully by the time she develops resistance to first-line ARVs, the second-line ARVs will be accessible to her.
Come and live over here. I can make the world safe for you. Come and live over here. I can make the world safe for you. Nothing bad'll happen now. Nothing bad'll happen now.